Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 12 practice NCLEX questions. Without delay, let's get started.
A client who is recovering from chest trauma is to be discharged home with a chest tube drainage system intact. The nurse should instruct the client to call the physician for which of the following? 1. Respiratory rate greater than 16 breaths per minute. 2. Continuous bubbling in the water-sealed chamber. 3. Fluid in the chest tube. 4. Fluctuation of fluid in the water-sealed chamber. The correct answer is 2. Continuous bubbling in the water-sealed chamber indicates a leak in the system, and the client needs to be instructed to notify the physician if continuous bubbling occurs. A respiratory rate of more than 16 breaths per minute may not be unusual and does not necessarily mean that the client should notify the physician. Fluid in the chest tube is expected, as is fluctuation of the fluid in the water-sealed chamber. For a client with rib fractures and a pneumothorax, the physician prescribes morphine sulfate, 1 to 2 milligrams per hour, given IV as needed for pain. The nursing care goal is to provide adequate pain control so that the client can breathe effectively. Which of the following outcomes would indicate successful achievement of this goal? 1. Pain rating of 0 on a scale of 0 to 10 by the client. 2. Decreased client anxiety. 3. Respiratory rate of 26 breaths per minute. 4. PO2 of 70. The correct answer is 1. If the client reports no pain, then the objective of adequate pain relief has been met. Decreased anxiety is not related only to pain control. It could also be related to other factors. A respiratory rate of 26 breaths per minute is not within normal limits, nor is the PO2 of 70, but these values are not measures of pain relief. The primary reason for infusing blood at a rate of 60 milliliters per hour is to help prevent which of the following complications? 1. Emboli formation. 2. Fluid volume overload. 3. Red blood cell hemolysis. 4. Allergic reaction. The correct answer is 2. Too rapid infusion of blood or any intravenous fluid can cause fluid volume overload and related problems such as pulmonary edema. Emboli formation, red blood cell hemolysis, and allergic reaction are not related to rapid infusion. The physician has inserted a chest tube in a client with a pneumothorax. The nurse should evaluate the effectiveness of the chest tube. 1. For administration of oxygen. 2. To promote formation of lung scar tissue. 3. To insert antibiotics into the pleural space. 4. To remove air and fluid. The correct answer is 4. A chest tube is inserted to re-expand the lung and remove air and fluid. Oxygen is not administered through a chest tube. Chest tubes are not inserted to promote scar tissue formation. Antibiotics are not used to treat a pneumothorax. When assessing a client with chest trauma, the nurse notes that the client is taking small breaths at first, then bigger breaths, then a couple of small breaths, then 10 to 20 seconds of no breaths. The nurse should chart the breathing pattern as 1. Cheyne-Stokes respiration. 2. Hyperventilation. 3. Obstructive sleep apnea. 4. Beale's respiration. The correct answer is 1. Cheyne-Stokes respiration is defined as a regular cycle that starts with normal breaths, which increase and then decrease followed by a period of apnea. It can be related to heart failure or a dysfunction of the respiratory center of the brain. Hyperventilation is the increased rate and depth of respirations. Obstructive sleep apnea is recurring episodes of upper airway obstruction and reduced ventilation. Beale's respiration, also known as cluster breathing, is periods of normal respirations followed by varying periods of apnea. A 12-year-old with leukemia is receiving cyclophosphamide. The nurse should assess for the adverse effect of 1. Photosensitivity. 2. Ataxia. 3. Cystitis. 4. Cardiac arrhythmias. The correct answer is 3. Cystitis is a potential adverse effect of cyclophosphamide. The client should be monitored for pain on urination. Photosensitivity, ataxia, and cardiac arrhythmias are not adverse effects associated with cyclophosphamide. Which of the following is the highest risk for a child with leukemia whose lab values are as follows? WBC 6,500, platelet count 40,000 microliter, and HCT 41.2%. 1. Activity intolerance. 2. Bleeding. 3. Impaired tissue perfusion. 4. Infection. The correct answer is 2. A normal platelet count is 150,000 to 400,000 microliter. A platelet count of 40,000 microliter is low and puts the child at risk for injury, bruising, and bleeding. Hematocrit of 41.2% is normal. Therefore, the child will have adequate oxygenation and tissue perfusion. 6,500 is a normal white count. Therefore, the child has no increase in risk for infection. Which of the following beverages should the nurse plan to give a child with leukemia to relieve nausea? 1. Orange juice. 2. Weak tea. 3. Plain water. 4. A carbonated beverage. The correct answer is 4. Carbonated beverages ordinarily are the best tolerated when a child feels nauseated. Many children find cola drinks especially easy to tolerate, but non-cola beverages are also recommended. Orange juice usually is not tolerated well because of its high acid content. Tea may also be too acidic, and many children do not like tea. Water does not relieve nausea. After teaching a child with leukemia scheduled for a bone marrow aspiration about the procedure, the nurse determines that the teaching has been successful when the child identifies which of the following as the site for the aspiration. 1. Right lateral side of the right wrist. 2. Middle of the chest. 3. Distal end of the thigh. 4. Back of the hip bone. The correct answer is 4. Although bone marrow specimens may be obtained from various sites, the most commonly used site in children is the posterior iliac crest, the back of the hip bone. This area is close to the body's surface but removed from vital organs. The area is large, so specimens can easily be obtained. For infants, the proximal tibia and the posterior iliac crest are used. The middle of the chest or sternum is the usual site for bone marrow aspiration in an adult. The wrist, chest, and thigh are not sites from which to obtain bone marrow specimens. After doing well for a period of time, a child with leukemia develops an overwhelming infection. The child's death is imminent. Which of the following statements offers the nurse the best guide in making plans to assist the parents in dealing with their child's imminent death? 1. Knowing that the prognosis is poor helps prepare relatives for the death of children. 2. Relatives are especially grieved when a child does well at first but then declines rapidly. 3. Trust in healthcare personnel is most often destroyed by a death that is considered untimely. 4. It is more difficult for relatives to accept the death of an older child than that of a toddler. The correct answer is 2. It has been found that parents are more grieved when optimism is followed by defeat. The nurse should recognize this when planning various ways to help the parents of a dying child. It is not necessarily true that knowing about a poor prognosis for years helps prepare parents for a child's death. Death is still a shock when it occurs. Trust in healthcare personnel is not necessarily destroyed when a death is untimely if the family views the personnel as having done all that was possible. It is not more difficult for parents to accept the death of an older child than that of a younger child. A 10-year-old with leukemia is taking immunosuppressive drugs. To maintain health, the nurse should instruct the child and parents to 1. Continue with immunizations. 2. Not receive any live attenuated vaccines. 3. Receive vitamin and mineral supplements. 4. Stay away from peers. The correct answer is 2. Children who are immunosuppressed should not receive any live attenuated vaccines. Clients who are immunosuppressed and are given live attenuated vaccines, such as measles, mumps, rubella, and oral polio vaccine, can develop severe forms of diseases for which they're being immunized, which can result in death. Inactivated vaccines may be given if necessary, but the client is not able to adequately produce needed antibodies, and it is recommended that immunizations be delayed for 3 months after the immunosuppressive drugs have been discontinued. Vitamin and mineral supplements are not normally given in conjunction with immunosuppressive drugs. When the client is immunosuppressed, the client should avoid only persons who have an infection. A transfusion of packed red blood cells has been prescribed for a 1-year-old with sickle cell anemia. The infant has a 25-gauge IV infusing dextrose with sodium and potassium. Using the situation, background, assessment, recommendation method of communication, the nurse contacts the primary healthcare provider and recommends 1. Starting a second IV with a 22-gauge catheter to infuse normal saline with the blood. 2. Using the existing IV, but changing the fluids to normal saline for the transfusion. 3. Replacing the IV with a 22-gauge catheter to infuse the prescribed fluids. 4. Starting a second IV with a 25-gauge catheter to infuse normal saline with the transfusion. The correct answer is 2. The best evidence indicates that a catheter as small as 27 gauge may safely be used for transfusion in children, but blood must be infused with normal saline, not dextrose. A 1-year-old should be able to maintain their blood glucose for the 2-hour duration of the infusion without the need for a second IV.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.